Hello and welcome to the Beauty Doctors show by Cocoona. Today we have a very impressive personality. His dedication has been relentless. His contribution to the healthcare in the UAE and Dubai has been impeccable. He is fighting for obesity for people and he has done it very safely. And I can vouch for it because I'm associated with him for last 20 years. So I'm going to introduce our special guest today, Dr. Girish Juneja, who is a laparoscopic and a bariatric surgeon. Dr. Girish, welcome to the show.
Thanks for inviting me.
I know he has been affiliated with several big institutions in the UAE. He has been in Abu Dhabi, in Dubai, and he has also several international affiliates and associations with him. Dr. Girish, what are these associations and how have you acquired them?
Yeah, during my surgical journey, pan-Asian, pan-world, lot of federations I have been member, prominent members also. If I choose top 3 out of them, one is dedicated to obesity surgery, ASMBS, which is American Society for Bariatric Surgery. And then there is a worldwide obesity federation called IFSO, International Federation. Beside this, I am a member of robotic surgery also, because I am doing, of course, nowadays I don't do open surgeries, all is laparoscopic, endoscopic and robotic. So all 3 ways I do bariatric surgeries, yeah.
So you've been here for last almost more than 25 years, I think, much before then I joined in here in Dubai.
Around 20 years.
20 years, okay.
Yeah.
And you have performed several surgeries. How many surgeries, bariatric surgeries you would have performed?
See, there are 3 components in bariatric. It's not only surgical. Surgical, if we say, then maybe more than 1,000. The laparoscopic sleeves and bypasses and revisional, lot of references I get. And beside that, there is a non-surgical gastric balloons. Again, 1,000 plus we have done it with good results. And then there is endoscopic sleeve gastroplasty. Between non-surgical and surgical is endoscopic ESG. So overall, maybe you can say 2,000 to 3,000 procedures.
Wow. So this is interesting actually, because I know bariatric surgery sometimes can be radical, sometimes it can cause a lot of weight loss. But there are many people who do not want to go through excessive weight loss. So what are those middle grounds that you can have in bariatric procedures that can control the weight loss?
See, number 1 is surgical technique. If you do the procedure right way, because a lot of patients, even I think yesterday one patient came, he was doing Zoom consultation and they were asking that, husband was asking, I don't want my wife to be with sunken cheek. So I was a bit smiling because none of my patients, they go into excessive weight. Number 1 is technique. If you do the proper surgery with proper technique and you try to avoid malabsorption, especially in gastric bypass patients, nobody can see or say that they have lost excessive weight. So it's a well-balanced approach, plus you have to follow up the patient. Anytime during the journey down, my patients, even 5 years, 10 years, they are following up with me. Means anytime we feel something is going to be going wrong way, we catch it early and treat it. Patient never has those kind of problems. Yeah.
So you mean to say now follow-up is very important, and I do agree with you.
In bariatric surgery, follow-ups number 1 essential factor, I'll say. A lot of patients which goes abroad to save money and come back, I tell them no. It's not gallbladder or hernia surgery. This surgery you should do where you live. So this is the first and foremost factor for bariatric procedures. You have to be in touch with your doctor who is not overloaded with surgeries. He can give you plenty of time and prevent any problem in the future. I have patients who are coming 10, 15 years down the line, even from Abu Dhabi, all over UAE, still they follow up with me. We say birthday meeting once a year. We do that.
That's interesting, yeah. And I agree. I mean, not only in bariatric surgery, but in any surgery, follow-up is extremely important.
Extremely important.
Because it does take a lot of time for the patient to recover and also to maintain their health and lifestyle. But tell me, you've done thousands of procedures, and what I'm impressed with and I'm amazed with is your safety margins.
Yeah.
And I see that you are one of the safest surgeons. I'm very proud to say that I'm associated with you. So what keeps you safe?
I can say number 1, grace of God. Number 2, of course, by the way, I'm having a 0 leak rate in bariatric surgery, which is the most, catastrophic complication if happens. and most of the surgeons, they have it. So what we do, right selection of the patient, a good pre-operative, pre-surgical preparation with good education to the patient before we take patient to the table. And then, as we discussed just now, good follow-up, minimum 18 months I do. And I do free follow-ups for the patients every 3 months. So along with this, good team, the best surgical material and instruments, and on the top, a good surgical, experienced surgical technique. So these all together will lead to the safety of the surgery and good outcome.
Yeah, that's excellent. Congratulations for that.
Thank you very much.
Can you take us through what are the different bariatric procedures? Start from the, the minimal that patient can consider to obviously the most, extensive procedure which is required for some of these morbidly obese patients.
Yeah, as I told before, there are 3 segments of weight loss procedures. Now, surgically we decide, but ultimately patient has to decide, because some patients, they don't want surgery. So we have to offer them 360 view of the procedures. Non-surgical, very popular are gastric balloons, 2 kinds. Nowadays they say aileron or smart capsule, other is endoscopic balloons, which are temporary but gives you significant change in your lifestyle and makes you more excited about maintenance of weight loss and associated condition, how to improve. Then is the surgical. Morbidly obese, we offer surgery. They give the best results, around 30% of your body weight. Most common is sleeve and breast bypass, whether it's mini gastric bypass or Roux-en-Y. So these are the 2 ones. Now, some patients don't want surgery. Some patients don't want temporary like gastric balloon. So we have a middle path, endoscopic sleeve. Not as radical like the resection like in surgery, and not as temporary like gastric balloon, in which through endoscope we go and we put non-absorbable stitches which stays lifelong. Once we tie the stitches through mouth, the plication of the stomach happens and the lumen of the stomach is becoming smaller for lifelong. So you can say permanent gastric balloon or mimicking the sleeve but little less effective, middle path, around 15 to 20% of your gross body weight can come down within few months. So these are the 3 surgical components. And now different medications have come up, like Mounjaro, Lilly and all that. So long term they have side effects. Once you stop, they gain back weight. So what we have started, combination therapy. You have a procedure, non-surgical, surgical, or regain of weight in future. So there, if anatomically patient is still okay, we start using combination of these medications. So they help us in further maintenance or further reduction of weight. So this is a combination of all procedures as per patient desire and as per what you think professionally, we offer them. And as I told, follow-up is must in all the procedures.
What do you think about the Botox, the intragastric Botox, which I keep hearing from patients?
Yeah, intragastric Botox, I tried long back, but number 1 is not a FDA approved procedure. Number 2, variable results are there. Means some patients will have a good effect, some patients will not have good effect, and you have to repeat after 3 months. And sometimes we have seen liver abscesses after gastric Botox. So whenever patient asks me about Botox, I discourage them and tell them that there are other multiple very effective procedures with minimal side effects. So choice is yours.
Now I'm going to put you in spot now. Tell me why Cocoona? Why you decided to stay committed to Cocoona, and which is very much appreciated.
Yeah, good question. I'm practically married to Cocoona so many years since I came to Dubai. See, I like the aesthetic part of Cocoona. For example, colors of your chairs, it attracts me. It makes me relaxed, number 1. Number 2, Cocoona has a very good digital presence to connect with patients. And I appreciate, I have seen very few clinics who does this very consistently. And for last so many years I am seeing that. And I feel comfortable at home. So all these factors together, I'm with Cocoona.
Yeah, I think I'm thankful to the team that I have, that has supported not only him but me as well. That's great. I'm also amazed with one more thing, and I've never told you this.
What is that?
I admire how you have maintained yourself in last 20 years that I have been seeing you. Do you have a tap in your tummy that you do like a small bypass and take things out?
No. Of course, genetically from parents. Number two, I do 3 times a week gym, and on the top golf.
Okay.
So eating, I'm not restricted. Whatever comes, I eat, but in controlled way, no excessive in any direction. So sports plus exercise plus, if you are smiling whole day, you are surrounded by people who are very good in positive approach, it leads to good health and good life. That's it.
Wonderful. And I think you are an inspiration. You keep inspiring me as well. I'm pretty sure you inspire your patients as well, and it's so important to keep ourselves fit,
Thank you.
Now, one of the very traditional, it's very interesting, I want to tell you, the bariatric procedure which actually reduced a lot of weight was zipping your mouth. Tell me about it, interdental wiring. That used to be historically a way.
Yeah, I think that is the historically first bariatric procedure we can say. But of course, it can't succeed. You can't close the mouth. Yeah.
But then you have to be watchful on what you're eating.
So indirectly, it says that you should close your mouth when it's needed. So selectively open your mouth, not even eating, but in talking also with society, in the society. So wiring of mouth or shutting your mouth without wire is a good example.
So tell me, what led to, in your career, you to be a bariatric surgeon?
Yeah, it's an interesting story. I was in Vienna, Austria in 1998 or 99. So I met one of my colleagues. He was an Austrian surgeon. So he invited me to see his hospital. So I went to see the hospital, and during our working lunch, he showed me a few photographs. 3-4 photographs. He told, what is your comment? Without telling anything. So I saw they were looking beautiful. My comment was that they looked like models. And then he told, wait. Then he brought another 3-4 photographs. He told, what do you think about them? These are the same pictures before my procedure. So I was surprised, I was amazed, and I was really excited that how bariatric can transform from this shape to the new shape, which to me looked like a models. So I told, no, I should learn these techniques, how to reduce it, and offer to my patients. And that was the turning point. Visit to that hospital with friend. I decided that I should enter into this field and start offering my patients, because it's a real transformation happens after these procedures. Not only shape-wise, but metabolically, diabetes, hypertension, sleep, snoring, PCOS, all improves.
And I'm so thankful that you also joined hands with me, in this transformation journey where we want to transform our patients' life, not only just appearance. We all know that UAE and Dubai is all about safety. We feel very safe here. This is probably one of the safest countries in the world. And when I came to Dubai in 2005, I decided one thing, that I'm going to make my procedures very safe. And I know Dr. Girish did that too. And we have done the journey of 20 years keeping our patients safe. So I hope that all our colleagues, we make our Dubai and UAE safe in healthcare as well. So thank you very much, Dr. Girish, for joining us. It's been wonderful, and look forward to chat with you more.
Thanks for having me here, and hopefully the association will continue as it is.
Great. Thank you.
Thank you.
On this note, I would like to end the session for today and come back with another exciting episode at Beauty Doctors by Cocoona. Stay tuned. This is Dr. Sanjay Parashar signing off.